Good afternoon, everyone, and thanks for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Saqib Shahab. Joining us over the line from Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have an opening statement. Then we'll have time for questions. Premier?
Well, good afternoon, everyone. Today we are reporting 3 additional cases, as well as 5 more recoveries. I don't have any new reopening announcements to make today, but I expect to announce the dates for all of the remaining Phase 4 businesses and facilities early next week. This will include casinos, bingo halls, as well as indoor sports facilities such as indoor pools and rinks. As we have moved through the phases of the Reopen Saskatchewan plan, case numbers have remained low in most of the regions of our province, except for a couple of localized outbreaks in the northwest and now in the southwest portions of our province. We continue to work closely with those individual communities to help control the spread through testing, through contact tracing, and ultimately self-isolation. Outside of those 2 local outbreaks, there are now just 12 active cases in the rest of the province. With the low case numbers throughout most of Saskatchewan, I know people here are asking, why can't we just reopen everything right now? Why can't we just remove all of the restrictions and the guidelines and get everything back to normal? Well, trust me when I say I would like to do that as much as anyone. But it is just not realistic because the risk of the spread of COVID-19 has not disappeared. We can reopen, but we know how quickly this virus can spread if we stop following all of the good practices that have worked for us so far. Just look at what is happening in areas south of our border. In recent days, new case numbers have spiked to record highs in places like Florida, in Arizona, and in Texas. And that's what can happen, and it can happen very quickly if we are not careful. It's great that things here are getting more or less back to normal. Businesses are open. More people are back at work each and every day. We can go to the beach. We can go to the park and the playground. We can visit our kids and their kids can play sports. We shouldn't be scared or worried to do any of these things at any point. But we still have to keep doing things a little differently than we did before to keep ourselves as well as to keep others safe. We have to find the right balance here. And so what is that balance? And I look at it this way. When I go out fishing or on one of our beautiful lakes in Saskatchewan, I've never scared or worried out on my boat, but I still wear a life jacket, just in case. It's a smart thing to do, just to be safe. Physical distancing and good personal hygiene habits are exactly the same thing. They are your life jacket when you're going about your everyday life. When you're at work or when you're out shopping or visiting your friends and neighbors, these simple, common sense practices will keep you safe and they will keep those around you safe. So no one should feel scared or worried to go out and about and do the things that you normally would do. But just be safe about it. Keep your life jacket on. Physical distancing, washing your hands and using hand sanitizers. Don't share your food or drinks with others. We've been so very successful thus far because of the smart, practical, common sense actions of the people of this province. So we need to keep that going. That's how we will continue to keep our case numbers low and avoid the kind of spread that we are seeing in places like Florida, in Texas, and in Arizona. It's how we will keep everything open and life in Saskatchewan as close to normal as possible in the weeks and months ahead. So now I turn it to Dr. Shahab for a few comments.
Thank you, Premier. So we had some questions on hospitalizations and other data on Tuesday. So I have a few slides that I'll walk through first, and then I won't go over the case numbers, but then I'll just make a few further remarks after that. So this data may not be up to date as of today, as in the news release, but it may be about a few days old because it takes a bit of time to assemble the data and analyze that. But as you can appreciate, if we look at our total case numbers, the initial case numbers to the left are the light green ones. They were mostly due to travel, and that has continued at much lower levels throughout the last 3 to 4 months. And then most of our cases, which have been due to transmission within Saskatchewan, As you can see, initially very small. It was mostly all due to travel, and then some spikes towards the middle, which was mostly due to outbreaks first in the northwest and now in the southwest, but a few mass gathering events. But then it has settled down quite a bit. But we do see a few spikes that are mostly due to localized outbreaks. If you look at number of cases confirmed by age and gender, so we do notice that we do have cases in every age group, including under 19. Most of our cases are in young adults, and then cases in older adults as well. And we do see that cases seem to be more frequent in women than in men, but of course I'll show later that hospitalization and serious adverse events are more common in men, and this is similar to what has been seen internationally as well. And if we look at major clinical presentations for which people are seeking testing, I think one thing that may be true is that women are more likely to seek testing even if they have mild symptoms. So it's just a message to everyone, but especially men, that if you have any symptoms, do consider testing. Don't hold back thinking that it's something that'll go away. And if you look at the most common symptoms, obviously cough is the most common at 58%. 2/3 of people have a cough. Fever is there in about 1/3 of people at the time of testing. In some cases, the fever can come later, or if you're younger or have a very mild illness, there may be no fever, so that's worth remembering. Headache seems to be common, as well as sore throat, stuffy, runny nose, muscle pains. You can have diarrhea rarely, lethargy, shortness of breath, of course, is a serious sign. You should seek urgent care. And you can also have loss of smell and taste, which we have seen in about 16%. It's been reported quite widely. But obviously, loss of smell and taste can happen due to many other reasons, even any cold illness. So in the fall, we have to remember that every time you get loss of smell or taste doesn't mean COVID. It could be a lot of other reasons. But of course, that's one of the signs for which you should seek testing for COVID. And of course, aches and pains, including joint pains. So there's a long symptom list for which you can seek testing, and the threshold for testing is very low in Saskatchewan. You can get it anywhere. You can get it if you have any of these symptoms or if you have any concerns as well. When we look at hospitalizations and deaths through the 5 broad geographies, we have seen, and this is correlated with a larger number of cases as well, as part of the localized outbreaks. We've seen more hospitalizations and deaths in the far north and in the north, lower in the central part of the province and in the south rural areas, but that has increased a bit because of the localized outbreak in the southwest, so 4 hospitalizations in the south currently. A fair number in Saskatoon and Regina, but I think the message here really is that overall we have been fortunate in having lower number of hospitalization and deaths, and part of it was, as the Premier mentioned, all Saskatchewan residents going well above and beyond the recommendations in March and April, but some caution now that we still have to keep observing physical distancing, keeping each other safe, and so that we continue to see this lower trend of hospitalizations. And while every death is a tragedy for the family and loved ones, our death rate also has been much lower, and also because of the excellent work that has been done by staff in long-term care facilities, personal care homes, assisted living facilities, where we have not seen major outbreaks in those settings, and the patience and forbearance of loved ones in terms of complying with all the recommendations for visiting. In terms of more details around hospitalizations and ICU admissions and deaths by age group, this is another question that came. I think we have to appreciate that hospitalizations have happened in Saskatchewan in every age group. We've had, till date, 51 cumulative hospitalizations in every age group, including under 19. 1 in under 19, 4 in 20 to 39 age group. So even in that under 40 age group, 20 to 40, we have seen 4 hospitalizations. But of course, hospitalizations pick up in older age groups, so 40 to 59, 13 male, 7 female, 60 to 79, 10 males, 8 females, 80 plus 4 males and 4 females. So you can appreciate that overall 28 hospitalization in males and 23 in females. And hospitalizations are more common in men than women, even though test positive results were more common in women, especially in the younger age groups. So this seems to be aligned with what has been reported internationally. For ICU admissions, again, thankfully, no ICU admissions in people under 40, but 4 males and 5 females have been in ICU in the 40 to 59 age group, and I think that's a word of caution that adults who are in that middle age group still have to be cautious. And then, of course, ICU admissions pick up in the 60 to 79 age group, 6 in males, 3 in females, and in case of deaths, again, unfortunately, deaths are more common the older you are. 1 death in the 40 to 59 age group, 5 deaths in males and 3 in females in the 60 to 79 age group, and 4 deaths, 2 in males and 2 in females in that 80 plus age group. So 8 deaths overall in males, 5 in females, all in the 40 and older age group. But obviously the rate of death, the risk of death rises as you get older. And again, this is very consistent with what we've seen in other jurisdictions. There was a question around ventilator use. While we don't have that data precisely, but we do have data on intubations, which could be a proxy for ventilator use. And we have to remember that in ICU, you can be on high flow oxygen. You may or may not require intubation ventilation for a smaller period of time, but in any case, we have seen 5 intubations in that 40 to 59 age group, 4 in the 60 to 69 age group, and 2 in the 70 to 79 age group. So we had 18 ICU hospitalizations, but as per our data, 11 instances of intubation. So not everyone who goes to ICU requires ventilation. So that is one of the questions that came up. In terms of underlying risk factors, they are similar to what has been reported internationally. So hypertension, is very common in Saskatchewan, and so hypertension, lung disease, diabetes, heart disease, these seem to be the most common risk factors that increase the risk of serious illness. And of course, these are more common in older age groups and to some extent more common in men as well. And then finally, last 2 slides, if we look at a number of people who had tests ordered by age and gender, we can appreciate that people are getting tested in every age group, and that is very important. Even if you have mild symptoms, even if you're younger, do get tested if you are symptomatic of any concerns, because while it may not be a serious illness for you, the fact that you are tested and public can follow up your contacts is really important, especially if your contacts may be older or higher risk, because then they can be isolated. We can stop further transmission, and that is critical for individual cases and is critical when we have outbreaks to control outbreaks. And finally, our effective reproductive number did go up over 1 in the north. It has gone up a bit in the central and south areas because of the southwest outbreaks, but overall we remain below 1 at this point. Although we have had a high number of cases over the last 2 weeks, the fact that they are all linked together in localized geographies, the northwest and the southwest, is at least some reassurance that they are localized outbreaks and not a high number of cases throughout the province. But having said that, every outbreak is a reminder for us that COVID is here, is around, and can come back very quickly if we give up, social distancing, practicing all the things we have been practicing, and towards the fall again, being especially conscious of physical distancing when we move indoors and appropriate mask use as required. And my final couple of comments would be that I think one thing that we have received anecdotal reports, and I think some of us have observed, is that a lot of people are out and about. Most people are complying with physical distancing, but certainly in workplaces or even in environments where customers are coming, there seems to be good physical distancing between customers and staff, but staff may be congregating together just because they are familiar with each other and over breaks and so forth. But again, that is a risk for transmission, and in other provinces, those are the settings where transmission has been reported, where you're not maintaining that physical distance between staff when you go to work every day. And I think that's just something we need to remind ourselves of when we go to work every day as well. So anyway, I'll stop there, and thank you very much.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the room. Steph?
Yeah, to the Premier. The deal with the U.S. to keep the border closed expires, I think July 21st is when it's set to expire. Do you think, just given the resurgence of cases in the United States, that Canada should open its borders to the U.S.?
I would suspect, and this has been a discussion, will continue to be a discussion on our, not only our Council of Federation calls, one of which I just finished this morning, and our First Minister's calls, one of which I'll be going on here shortly. The discussion around international travel, and more particularly international travel into the U.S., as they are our largest trading partner and very close geographically. We've been talked about that many times. I would suspect, as you see provinces across this nation, I'll speak for Saskatchewan, but I suspect you see that we probably aren't ready to move in the very near term to additional international travel beyond what is already occurring for the essential services that we are providing our communities. I don't know what the reciprocal feeling will be from the United States. I might have a better inference of that after our First Minister's call here this afternoon. So I think there's still likely some time before we open up broadly international travel. In saying that, we see interprovincial travel starting to open up across this nation. The Atlantic Canadian provinces have opened up their bubble to one another and are, I think, planning in the future to open up to the rest of Canada. We never exclusively closed down interprovincial travel here in Saskatchewan and in many areas in Western Canada. There was a time when we recommended that it should not happen unless it was necessary, and we would still say that if it isn't necessary, one should not be traveling interprovincially, as it is a way for this virus to spread out and into the province. One thing that I think we could be working on between the political side of the approach to COVID-19 across the nation and the public health side is, as we open our economies, there is going to be pressure for additional interprovincial travel and ultimately at some point additional international travel. And there is an opportunity for us to not worry so much about when that might happen, but to have a conversation around what safe parameters of international travel would be. They may include having a negative test before you travel, or having that test when you land and self-isolating until the results of that test are available. I don't know what those parameters exactly would look like, but there is other countries around the world that are starting to travel internationally, and I think this is a time that would be well used by all levels involved in this Canadian response, from the provinces, the public health side, and the federal government, on what do those safe parameters look like, so that when we do get to that decision point around expanding potential international travel, that we have a safe set of parameters in place, a set of parameters that the people in Canada can be confident are limiting the spread of this virus while we eventually will open up some travel.
Follow-up, Steph?
Yeah. To be clear, would you consider next month to be too soon? And what, as chair of Council of Federation, what is the province's message to the PM on this one, as you're all about to kind of hop on that call?
I think you will see. I think you will see provinces be somewhat hesitant to move forward by next month on international travel. However, there won't be a consensus. There are some provinces that are looking to move sooner rather than later when it comes to not only interprovincial travel but international travel. Those are provinces that have direct links, and Saskatchewan has many of them, direct links with some of the products that we supply the world, and some of how our economy is centered with a number of states down throughout the Midwest, for example. So I think in general you will see a hesitance to be supportive of opening up that border in the near term. But I think in the out months that conversation may start to change as our economies start to open up more broadly and start to be, quite frankly, requesting additional international travel in order for them to function. But before we are real serious about international travel, we need to have our interprovincial travel opened up, and we don't have that at the moment.
We'll take our next question on the phone line.
We have Adam Hunter with CBC.
Hi, I'm wondering if the province has any plans to follow up Alberta's plan on serology testing if that's something that the Premier is interested in, and what Dr. Shahab thinks of maybe pursuing that in Saskatchewan.
I would be interested in that. We have had discussions about that. I'll Dr. Shahab, if you'd comment more specifically on where that is.
So the Royal Roanoke Provincial Lab is validating serology testing. You need to do 30 to 40 tests on patients who have recovered from COVID and at least are 3 weeks out from symptom onset to validate the test. So each province has to do that. And because of our low number of cases, especially in patients who may have required hospitalizations and are able to give blood samples for serology testing, that is taking some time. But yes, definitely we would like to have a serology test established in Saskatchewan on our platforms in the provincial labs within the Saskatchewan Health Authority. And the benefit of that, of course, is that at a clinical level, sometimes there may have been symptoms more than a week or 10 days ago due to COVID. And then later on, the testing itself may not be positive, the PCR test. So serology may be useful 3 weeks after symptom onset to determine the cause of an illness if it's progressing or there are other complications. So, for example, after severe COVID illness, the PCR test can become negative, but individuals may require hospitalizations for other medical conditions that may have worsened, like chronic lung disease or heart disease. And also, there are plans provincially and nationally to, at some point, use serology as a way of estimating the population who have been exposed. And given our low case numbers overall, we think that is very low. Certainly less than 5%, maybe even in the less than 1 to 2%. But certainly a survey using serology at some point will be useful to tell us what our actual transmission rate was. Thank you.
Follow up, Adam?
Yes, we've heard reports that there's people in the far north in Clearwater River that have been refusing tests. We know that based on the SHA's release a couple of days ago, there were concerns about people in the southwest refusing tests. I'd like to know just what the government's message is on this, and whether there are concerns that there may be a further spread with people not seeking or agreeing to tests.
Yeah, I would just comment on the spread of this virus. Is if you're adhering to all of the public health recommendations and orders that are in place, we should be pretty good with respect to not spreading this virus. And so if you're feeling under the weather, you don't go to work, you self-isolate for those months. Whether or not you get a test it would be up to you. But if you think you are exhibiting any signs of COVID or have been in contact with anyone who has tested positive, I would ask you to self-isolate for 2 weeks for your own safety. But just as importantly, for the safety of those around you that might be much more susceptible to the symptoms of very severe symptoms that can occur, in particular in our elderly, in our mothers, fathers, and our grandparents. So if not for yourself, please self-isolate for those in your family and in your community that you love that may be much more susceptible to the symptoms of this disease.
Just one comment I want to make, and I'd also like to maybe make that comment on, with reference to interprovincial travel, is that generally we know that people may go to work or may go to an important event even when they're feeling under the weather. And I think that's a risk we can no longer take with COVID-19. So there have been instances, for example, where both internationally and nationally, and even in the province, where you were not feeling well, but you went to that family event because there's a lot of social pressure. Internationally, it's been well described in Germany, where someone went to make a presentation at a business meeting. You've traveled thousands of miles. You just have a bit of a cough. Do you just cancel everything because you have a bit of a cough? Well, now you must, and that is essential. And the other thing is that if you're traveling for business or pleasure, have a plan about what you will do if you get even the slightest symptoms, how you will get tested at that new location, who do you call to get tested. A lot of that information is easily available on the provincial websites. And so you should have a plan that if I'm unwell, even mild symptoms, I will not go to that meeting, not go to that family event. I will stay in my hotel room, get tested, seek further recommendations, even if the test is negative, before proceeding further. But I think that discipline is going to be essential moving forward, because in many cases we've seen that no one intended to cause a mass transmission event. It was just that in some cases people are really asymptomatic, and hence maintaining that physical distance with people not in your household or virtual bubble. And secondly, even if you have mild symptoms, not going to that really important event for which you may have traveled hundreds of thousands of miles.
We'll take our next question on the phone line.
We have Lisa Schick with CJME.
Hi. When it comes to schools and classrooms, in the guidelines it says reading student temperatures before class is not recommended, but I'm wondering, is it allowed? Because I'm hearing from some primary school teachers that, they get sneezed in the face by kids before this, so they're wondering what kind of precautions they can take to protect themselves in the class.
So first of all, this is similar to my earlier comments. I think it is up to all of us as parents and older kids that, in high school, for example, that do not go to school if you're unwell. And for younger kids, for parents to be aware of their children, and if at the slightest sign of any symptoms, don't go to school. There are also clear protocols in the guidelines that if a child becomes unwell at school, there's no reason to panic. The child can safely be separated from other children in the classroom or in another room, and parents can be called. And if for some reason parents can't pick the child can even sit 2 meters apart or 2 rows apart in the bus and go home. We know that 2-meter distance will prevent transmission even if a child is unwell. We also know that in the fall, coughs and colds are very common in children, so we can't assume that every sniffle or cough is COVID-19, but we need to take reasonable precautions, and experience from other jurisdictions has shown that, with those basic precautions that are in the school guidelines, there has been very little transmission in other parts of the world where schools have opened, Australia, for example. And we'll continue to learn from the example of jurisdictions that have opened schools. We'll continue to work closely, both myself and my colleagues in the province, in the Saskatchewan Health Authority, with schools and school districts over the fall, to advise if there's increase in COVID transmission. But generally, I think we should be confident that as long as parents keep children home if they're sick, or if there's an adult in a household and the children are contacts of an adult, close contacts, they of course should not go to school for 2 weeks. As long as we follow those principles, we hope that COVID transmission in schools will be at a minimum.
Follow up, Lisa?
Yeah, but I guess in a situation where maybe a kid goes to school, they don't see their parents that morning, the parents aren't necessarily there to say you can't go to school. I mean, there could still be situations where these kids go to school and they have a fever or they might be sick. So, are there any things that teachers can do to make sure that, like that temperature testing or something, to kind of protect them in the class?
So I think we can certainly take this back for discussion, but generally it's felt that, while in the health system, when staff are going to a long-term care facility, there is that very specific health screen as well as temperature check, but that is primarily because the risk in a long-term care facility is high. But that does need some planning, and it takes time to screen, for example, staff coming in for their shift. And I think the same approach may not be feasible in a school setting, but certainly greater awareness from parents, older children, and by school staff about symptoms in staff as well as students is going to be very important in the fall.
I would just say, Lisa, as well, there is a group of ministry folks as well as Saskatchewan School Boards Association, Public Health, the Teachers Federation, are working precisely on what some of these more refined guidelines would look like as we return to school this fall. But Dr. Shahab has mentioned a number of times that this is a lower risk activity, and it has occurred in other areas. Quebec and British Columbia have returned to school at a lower level, albeit here this spring. Other areas of the world, like Australia, have also returned to school without significant risk to the kids or a significant risk of the spread of COVID-19. So no doubt there are challenges, and we will come to some conclusions on this collaborative working group with what parameters can be put forward to limit, minimize, and reduce the risk of spread of COVID-19. But we must once again remind ourselves that the goal is to not eliminate COVID-19. However, that would be a nice a goal. It's not a realistic goal. We need to manage the spread of COVID-19 so that we do not overrun our healthcare system and lose people that we love in our community. So the goal is to keep this at a minimal level to reduce the risk, and there is groups that are actively working on how we can do that in our school system.
We'll take our next question from the room. Karen?
We've had a few cases pulled out of the Saskatchewan numbers because they were from other provinces. Do we have some coming in that are Saskatchewan people who were found positive somewhere else?
Yeah, I don't have the exact numbers, but that is something that all the provinces agreed to. And usually it's minor numbers, like I think we had 8 or 9 or several months who were reconciled. And the reason we do that is that we don't want to double count or undercount cases nationally. So that always happens as a matter of routine. And I'm sure, I don't have the exact numbers with me, but I'm sure there were some cases that were, for example, in Saskatchewan, tested in Saskatchewan, but were residents in other provinces. Similarly, there may have been individuals who may have been in other provinces who were from Saskatchewan, and that reconciliation does happen. And primarily it's not to double count.
How does that happen when people weren't supposed to be traveling?
Like the Premier mentioned, generally we have not had restrictions on interprovincial travel in Western Canada, and essential travel was allowed. So generally it's just a matter of, and then there may have been other situations where for work or other reasons, people may have been in another province. So it may not have been immediate travel, it may have been people are just in another province for a longer period of time, and their health card is, you retain the same health card for up to 3 months in some cases. So there are a variety of factors why that reconciliation happens.
There's I think it's also incumbent on us to just remember there has been a reasonable amount of travel, both interprovincially and internationally, throughout this us addressing this pandemic in Saskatchewan. I think of individuals that work in other areas of Alberta and even Manitoba, as well as other areas of Canada, in camp jobs throughout the north, and they have traveled throughout this, albeit with precautions. We have had supplies arrive in our grocery stores and in our retail stores that have been opened throughout this from other areas of Canada and as well as from areas in the U.S. And so there is truck and transport drivers that have been working diligently and admirably throughout the pandemic. There is, you think of the agri-food industry and the fertilizer that has come into Saskatchewan over the course of this spring, the fuel that has come into Saskatchewan over the course of this spring, as well as all of the chemical and the crop protection products that are coming in this spring. You think of the potash that has been leaving throughout this pandemic to other areas of the world. So there most certainly has been some travel, both interprovincially and internationally, throughout this pandemic. That being said, we've been very fortunate in the fact that our numbers have been very low, and we're very proud of that, and that is due to the efforts that people have made. And I think what I am asking them to do here today is to continue with those efforts. Our success is not predetermined. We do have that personal responsibility to continue to practice our physical distancing, practice good hand hygiene. We can do that. We can reopen the economy, and we can most certainly do it safely.
We'll take our next question on the phone line.
We have Ashley Martin with a Leader Post.
Hi, just wondering about, I guess, where live music venues fit into the reopen plan. I'm wondering if they might count as a bar, or if they have the capability of setting up chairs similar to a theater. Where would those fit? Because I think people are wondering when they can go out to see a musician play at a safe, socially distanced show.
Thanks. So, and I appreciate that there's been many virtual performances by musicians that have kept everyone's spirits up. So we need to thank our colleagues in the performing arts for that initiative. And the guidance is being developed, and it's being based on some principles, and that applies even to choir groups, for example, or singing, for example, when you're at a place of worship, for example. And so we do know that 2 meters generally works well. If you're singing and you're facing someone, it's probably a good idea to be more than 2 meters away, maybe 3 meters or more. Same applies to wind instruments. That the evidence is there that if you're playing a wind instrument, a greater separation among musicians and from musicians and the audience is a good idea. So obviously, those considerations about how a band or a group can perform, whether they're singing or playing wind instruments, those guidelines are being developed. We're learning from other jurisdictions as well. But certainly all those considerations are being taken into account. And I think the main consideration will be, how much space you can give safely between performers and the audience, and also for indoor and outdoor events, how large a gathering can you have in a safe manner. So those guidelines will be coming up as we progress with the reopening plan.
Actually, we're just constantly working our way through all of the different things that we do in society, and there's a lot more of them than I imagined coming into this. And there are some things like large group gatherings that are challenging. CFL football game, for example, is challenging, and we continue to work on those types of events. But we saw a drive-in concert here, I think, last weekend, which I think for all intents and purposes was extremely safe, as there was, very, very good physical distancing between the bulk of the people, aside from those that arrive together and are within their family unit. But I think there is a message here that with all of the public health orders and the public health recommendations that are in place, the goal for whatever we're doing needs to fit within those public health recommendations and those public health orders. I think earlier this week there was a tweet or a message that went out from the Ministry of Environment around the fact that we can't have fishing derbies in this province. Well, we can have fishing derbies in this province, but we need to ensure that whatever we're doing is following all of the public health recommendations and the public health orders that are in place. So for instance, you aren't able to have at that particular derby a buffet, or you aren't able to have a very large gathering after. But if you can work through your event with within the public health recommendations and the guidelines and the orders that are in place, you most certainly can move forward with that event in a safe manner.
You have a follow-up, Ashley?
Yes. So I understand you're working through the guidelines for this, and I can only imagine how many things there are to consider when you're making a reopen plan. But if live theaters are allowed to open, say you could have a performer on a stage, for example, at the Globe Theatre, a larger theater, are those guidelines, couldn't those just be applied to a different venue in terms of safety of how far away the performer should be from the audience and how spaced out the audience should be? It seems like just, the instrument might be different. Like someone's using their voice to perform a play, or someone's using a guitar to play a song. I guess I don't really understand why live theaters can open, but music performances or comedy shows or whatever might still be waiting. And also, will those happen in phase 4, or will they have to wait until phase 5? Thanks.
Yeah, thank you, and we'll come out with further guidance. But certainly for static venues, you can plan out in a more precise manner and start safely. So that will apply to, for example, static performing venues or theaters. But when you have something that's not a static venue, I think that has to be measured out and planned well. And certainly, sometimes there may not be the space to fit in a reasonable number of people, and even within the allowed limits, and a band or performers in a safe manner. But I think those are valid points, and what we are learning about what's a safe distance will be applied for future recommendations. and outdoor is obviously safer than indoor over the summer.
We'll take our next question on the phone line.
We have Mark Smith with CTV.
Hi. Further to the question about the provincial total being changed with cases being reassigned out to provinces outside of Saskatchewan, what is the process for determining where to assign those cases? And after those people test positive, are they isolating here in Saskatchewan, or are they traveling home? How is that working?
Yeah, so the attribution rules are quite complex, but generally, for example, I think we have, it's not in the latest news release, but if I remember correctly, we have 6 people who were outside the province and were attributed to our case numbers, and we have maybe 9 who were initially counted in Saskatchewan and attributed outside. And so there can be a variety of contexts, and of course it can be that someone is visiting family here, becomes symptomatic, test positive, and they complete their isolation as a case here. Or it could be that someone was here and then went back to another province, became symptomatic, but may have a Saskatchewan health card number or permanent address here and was visiting someone or on business travel. So the attribution rules are quite complex, but we can certainly make those available. But it generally means that what is your permanent residence, where were you when you got tested, and then of course, if someone is unwell, they should complete their isolation period where they are and not travel back. And similarly, if you are a close contact, you should ideally complete your isolation period where you are and not have to travel back in case you become symptomatic on the way. But obviously, there's some flexibility that's given by public health based on how far you have to travel and how safely you can do that if you're, for example, a close contact. But and we worked nationally at a process that is the same, so that we don't end up with, we accept and give back cases in a uniform manner just to avoid that double counting. But we have to remember that the numbers overall, maybe we got 6 cases who were diagnosed outside Saskatchewan. We gave back 9 cases who were diagnosed in Saskatchewan but belong to another province. The numbers are fairly low and overall don't make too much of a difference.
Follow up, Mark?
Yes. Has the provincial state of emergency been extended?
Yes.
Do we have any other questions on the line?
No, that is all.
Perfect. Thanks very much for joining us today, everyone. That concludes your time.